Diphtheria is another next infection caused by Corynebacterium diphtheria. 2 to 5 days incubation period, and the communicable period is variable. Source of infection is discharge from the mucous membrane of the nose, nasopharynx, and lesions on the skin. Direct contact with infected person and indirect contaminated objects will be the transmission route. Symptoms, well, you can remember from FNBP. Fever, neck will be you will see nasal discharge there, and then buccal neck appearance, swelling of the neck due to lymphadenopathy, and pseudomembrane. There is they will develop a grayish white membrane in the throat. So FNBP: fever, chills, nasal discharge, bull neck, and pseudomembrane. Next is an complication mnemonic as DARC: difficulty breathing, and arrhythmias, respiratory failure, cardiomyopathy. Diagnosis: throat culture will be done to see the throat swab to identify the bacteria, and the presence of the pseudomembrane in the throat will be the clinical presentation. Treatment will be antitoxins will be given to neutralize the toxin produced by the bacteria. Antibiotic with thromycin or penicillin to eradicate the bacteria. And prevention is DTaP again. In this case, same thing. And nursing intervention is isolate the child, droplet precautions, monitor for respiratory status and airway patency. Suction should be working, oxygen should be available, and the amber bag should be there. And tracheostomy set can be available too in case of severe things. Importance of vaccination on timely vaccination and supportive care, hydration, nutrition, and comfort measures. Next, we have scarlet fever. Scarlet fever is infection caused by group A beta hemolytic streptococci, and it is incubation period is 1 to 7 days and communication period about 10 days. Source of infection is nasopharyngeal secretions, and direct contact and indirect contact will be the transmission method. So symptoms you can remember from scarlet face, fever, angry red rash on the face, sandpaper like rash, and then cervical lymphadenopathy, swollen glands in the neck, inflamed throat with possible white or yellow patches, and tongue will be strawberry tongue, red bumpy tongue will be there. So from word face you can remember the scarlet fever, angry rash will be there, cervical lymphadenopathy, inflamed throat, and strawberry tongue. Diagnosis is throat culture. Strep cultures will be done for the presence of the bacteria. Education should be given to complete the antibiotics even after the things are like getting better. They should still finish their antibiotic course. And next we have a cool and soft diet, and brush, like you will tell them to start brushing after 24 hours, and droplet precautions, contact precautions will be there, and hand hygiene, avoid sharing of utensils, towels, personal items, infected persons. Cover your mouth and nose when you teach the children, right? And also teach the children to cover their mouth when they are sneezing, coughing, and stay home. Keep them away from school even after antibiotics for 24 hours, and they feel better. There is less circulation. So